the Greater West Bloomfield Chamber of Commerce always does their part to help highlight businesses in the area, and they are going to be doing exactly that in just a few weeks' time with a therapeutic ribbon cutting event at Robotic Muscle Therapy on September 25th at 5 p.m., which this business providing a very unique way to help get those muscles relaxed, help making your body feel good, and to help getting you up and moving again. And I want to go into that just a little bit more. So joining us right now on The Splash, we have Clinic Director with Robotic Muscle Therapy, Dr. Manny Veerappan. Dr. Manny, thank you so much for joining us today. So I want to get into, we'll talk about the ribbon cutting in just a little bit, but first I want to talk about, explain a little bit more about what robotic muscle therapy is.
Yeah, so we use robotic technology to lengthen muscles. There's actually the robot right behind me there.
Oh,
So it's a robotic arm. What we do is we place that on tight muscle tissue and it lengthens it. It's very similar to the uh, manual treatments that physical therapists do. It's just a little quicker and more effective.
okay, fascinating. And it's really cool to see the robot right here over Zoom with us. And what are some of the benefits of this practice from the traditional methods of physical therapy, would you say?
Yeah, so some of the most common things that we treat is low back pain, sciatica, neck pain. And with the robotic technology, like you see the arm right there, it's able to actually touch the hip flexor, which is a very deep muscle. You can't really touch that muscle with human hands. And if you touch it, it usually flares up, like the clients that we see. So with the robotic arm, it's nice and relaxed and it goes in there and just pushes. Treatments are usually like 60 to 90 minutes. We do a few different spots. The benefit also is because we're completely cash based as a practice, we can treat multiple areas of the body in the same visit.
Wow, that's great. And from what it sounds like you just explained, it seems like that these machines can get deeper into the body than most therapists are able to. Is that correct?
That's correct. And what I tell my clients is we start treating at 9 a.m. If I see someone at 5 a.m., my hands might get tired, but the robotic arm will not. It's more precise. So they get the same feel every time. We, document the percentages. It can put up to 30 pounds of pressure down. Most of our clients don't need that much pressure, but some athletes that we treat, some football players and things of that nature, it helps them. It's very effective.
Absolutely. Always great to have that option if necessary. Once again, joining us on the Splash Live, we have Dr. Manny Veerappan, Clinic Director with Robotic Muscle Therapy, who's going to be having a ribbon cutting with the Greater West Bloomfield Chamber of Commerce on September 25th. And I want to get into a little bit with that. How does it feel to be recognized by the community for this ribbon cutting?
We're very appreciative. We're honored to have that done. It's been something that we've been looking forward to now for a while.
That's great. And how are you going to be inviting the community into your business and working to further immerse yourself inside of that community?
Yeah, so most of our outreach is to like gyms or sports teams. Like we treat some West Bloomfield High School football players, some robotics clubs. Because there's some kids that are interested in that, so then they can see how the technology works. But most of the people we'll be inviting for that are clients that we've had or prospective clients, and just generally anyone in the community that can benefit from it.
That's great. That's really great to see you expanding that circle and to building upon what you have to further implement yourself into West Bloomfield. Now, I want to get into you just a little bit, Dr. Veerappan. What has been your history with robotic muscle therapy and your history with the practice, and what got you interested in learning about these techniques, would you say?
Yeah, so I'm a physical therapist. So reason I became a physical therapist, I'm big into sports, love watching sports, the biomechanics of it, um, and this technology then came into play because I had an injury. So I hurt my left shoulder playing soccer, dislocated it actually a couple times. So then I got to try this technology out when I first came on board. Did wonders for me because I do all the exercises and everything like that, but sometimes it just feels like I can't get that extra range of motion. So that robotic arm really helped like open up that muscle tissue for me. So that's kind of how I got into working at Robotic Muscle Therapy.
Interesting, and it's fascinating that you yourself learned about these firsthand, and then you started practicing this yourself. I think that's amazing. And going into that just a little bit more, would you say that this process has made the job easier? Would you say?
I think it makes it different. I think the
Okay, that's
reason
fair.
clients or patients come see healthcare providers isn't only for the treatment component, but it's also the education. So my big thing is promoting independence. So I usually only see our clients once a week because we are completely cash based, and I understand there's a financial implication. But the client education that we provide gives you independence long term. You know, changing in sleeping positions, driving positions, exercise regimens, things that they can implement, and then eventually, 6 months down the line after we've had our initial evaluation, they should be off on their own doing their own thing, and we're always there if they need us.
Once again, Dr. Manny Veerappan joins us on The Splash today, clinic director with Robotic Muscle Therapy, talking about the benefits of this practice. Now, I want to go into something you just talked about, having the patients learn and understand these practices for themselves. How helpful is that, especially with the ribbon cutting event coming up?
uh, it's it's essential to have that, I think. It's when the client understands what's going on, and they're able to be aware of their own body, it helps a lot as a clinician when we go to treat. Because then that conversation, we're almost speaking the same language per se.
Interesting, interesting, and absolutely great for all of the patients to have as much information as possible. I'm going to let you go in just a minute, Dr. Manny. One quick question before we let you go. Where can people go to learn a little bit more about robotic muscle therapy and about your practice?
Yeah, so we have a website, roboticmuscletherapy.com. We also have an Instagram page, Robotic Muscle Therapy, and then we just started a TikTok as well. So if you're on TikTok, you can go follow us there too. We're located at Maple and Orchard Lake, right next to the GNC.
Making that jump right to social media. Dr. Manny, thank you so much for your time today. Dr. Manny Veerappan, clinic director with Robotic Muscle Therapy. Thank you.
Thank you.